the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning in to Kaieteur Radio every Monday at 1:05 p.m. for your health matters.
The COVID-19 vaccine gives us hope for a healthier tomorrow. Have you received your shot yet? The Regional Health Services in Region 2 invite you to get vaxxed and get a chance to receive a COVAX hamper. A what? A COVAX hamper. When vaccinated, you will receive a coupon, and drawings will be done weekly at the Suddy Health Center and broadcast live on the Regional Health Services Facebook page on Sundays. Get vaccinated and get a chance to be one of 4 lucky winners of a COVAX hamper. Cameroon Supernam fighting COVID-19 for a safer region and safer Guyana.
Good afternoon and welcome to another edition of Your Health Matters here on Kaieteur Radio. I am your host, Rihanna Ramsey. Thank you for joining us. Without realizing it, most people require rehab at some point or other in their lives. Rehabilitation plays an essential part in any rounded health sector. Made simple, rehab is the action of restoring someone's health or normal life through training, treatment, or therapy. Particularly during the COVID-19 pandemic, rehabilitation workers have been helpful in getting persons to cope or recover from the illness or return to their normal lives. Last week, the Disability and Rehabilitation Service Unit under the Ministry of Health launched its 17th week of activities under the theme Rehabilitation in the Front Lines during the COVID-19 pandemic. Today, we will be speaking to Mr. Kingsley Isiguzu. He's a Nigerian, and he is the manager of the National Prosthetics Appliance Workshop, and he will be sharing with us on providing rehab services in the face of a global pandemic. Welcome to the program, Mr. Kingsley. I wouldn't even try pronouncing your last name before I bite my tongue.
Welcome.
Thank you for joining us, and you can go ahead and share with our viewers a little bit about yourself and the work you've been doing here in Guyana and abroad. And I know in your home country, Nigeria, you've been saturated in this area.
Okay. Thank you for granting me the opportunity to introduce myself. My name is Kingsley Isiguzu, just like she rightly said. I get that a lot in my name. Sometimes they bite it into pieces, you know. So, but by profession, I am an orthotist and prosthetist in orthopedics rehabilitation.
Mm-hmm.
I've been into this for over 10 years now. Yeah. So I currently started the managerial position. I had the managerial position in Guyana like a year now.
Mm-hmm.
So, and we've been trying to, improve in our system to make sure the rehabilitation, especially the orthotic and prosthetic aspect, gets to every Guyanese who anybody who needs the special care in orthotics and prosthetics in Guyana. So we try our best to reach as much as possible as we can. Then also I master in biomedical technology. I have my master's in biomedical technology. So it helps me to combine the both in trying to deliver my health. So that's it.
So For as a rehab worker, I mean, you're a frontline worker because you're in health. But for rehab, you do a specific type of work, which is like physically getting people back on their feet. In your area, it would be fitting them with artificial limbs and splints and so on. How has it been for workers like yourself during the pandemic? Just explain what that has been like for people.
All right. I can say in the face of this pandemic, it's been really challenging, and it's been really inspiring. There is nothing like when you get a patient back on his or her feet. That's the paramount interest in the rehabilitation. When you see a patient, holistically get back to work or get back to his or her feet again, it gives you the joy you actually need, aside whatever that is there to play out. So it's really been challenging based on the pandemic, but we apply the necessary precautions to see that we get things moving on the right track. So that's it.
And in terms of, I know that you work with the Ptolemy Reed
Rehabilitation Center.
When the pandemic first started, I don't know if you would have had to scale down your operation. How did it affect that? And from then to now, what has been going on? What's the progress in terms of reaching your patients and carrying out your service?
Okay. In answer to that, when the pandemic first broke out, we in Ptolemy we were running shifts. We tried to run shift, and first of all, some sections were closed up. All right, and I always admire the strength and the courage from my director, Dr. Manga. She's a woman.
I met her.
Yeah, she really tries a lot to make system work. So she was the one who said no. The sections or the departments cannot close up.
Yes.
Yeah, because despite the fact there is pandemic, we still have breakout. Which people get sick, people get disabled every day. So we still need to offer treatment for them or to them. So we can't just close up. We need to show care. We need to treat these patients. So we came back, and we started running shift to reduce the risk involved. So after that, when the vaccine now came up, so people started going for the vaccine, and the rate of COVID, the virus up till now, we don't know how it's been spread. So we try as much as possible to apply the COVID-19 guidelines from the Ministry of Health. All right, so we apply those guidelines, and also we try to, right now we're not running shift, we're fully back to work because of the vaccine. That's why the government provided the vaccine so that everybody can come back to work. So now we don't run shift. What we do now is we scale down the number of patients we receive or see per day. So that's how we work now.
And I'm sure you would have the normal protocols in place. You sanitize, you wear your mask.
We just like I said, we follow the COVID-19 guideline. We have sanitizers. Any patient that comes in, they try as much as possible to tell them to sanitize right from the gate. The security man checks their temperature and sanitizes them. So when they come into the workshop or the department, we also try to carry out our own measures also, to keep everything in check. Okay.
You said that basically you do a lot of work with disabled persons who were disabled in some capacity, probably through sickness, from birth, whatever is the root cause. You work a lot with people who are incapacitated in some area or another. What kind of persona, or what does it take for you to do your job? You have to have, I must imagine, some depth of understanding, some kind of patience. What does it take on a daily basis for you to actually carry out that function?
All right. To that, we have patients we have aggressive patients. We have patients who are understanding too. So different patients with different countenance as when they come. All right, a patient can come very bitter and sad. All right, so you don't just proceed to what you have to do for the patient. You just have to find a way to to make the situation subtle. You try to bring back the mind, and you try to show care. All right, before you now go down. That's why when a patient comes in, there is an assessment form for the data collection form. So in that data collection form, it goes a long way when you're taking the history of a patient. Okay, you don't just take history of a patient. You try to know the social background. In that social background, you be able to tell what the person is facing, all right, and know the counsel you're going to give to the person before you proceed for anything you want to do.
I see. So it's more than just providing.
It's more than just
physical
that. Exactly.
service. You have to have some.
We provide rehabilitation physically and emotionally. Yeah.
Some emotional support.
Support.
In terms of, there's different types of rehab, and you touched on it a bit. You said emotional support. Because we in Guyana, we have a lot of people who need not just physical rehab, but we have a lot of people who need counseling.
Yeah.
The ministry would provide that, and I know you know a little bit about it. Could you just let them know that this is available as well?
All right. When it comes to the emotional aspect, my center doesn't really dwell on the emotional rehabilitation or the mental health. Let me just put it that way. We'll be able to differentiate between the physical therapist and a psychologist. When you're talking about a physical therapist uses a holistic approach, all right, that has to do with the physical well-being. I mean, the physical or the entire body system, okay, the musculoskeletal body, okay, that's a holistic approach. Then when it comes to the psychologist focuses on the behavior and the thought process, all right, of that patient, which as it interacts with the environment. So you see, when it comes to that, I think a psychologist plays a better and more role to seeing patients with emotional and mental health, issues, all right, which the rehabilitation center where I work, we don't have that for now. But I think it can be solved other places, other facilities here in Guyana, all right. So, but we try as much as we can to still offer them moral and emotional support when it comes to we offering our service delivery, all right, health service delivery. So we encroach into that aspect a bit. The physiotherapists do a very good work in counseling a patient too, and we also have the social worker. All right, the social worker plays a very good role because they tend to enter into your financial background to know how your financial capability and know what you can actually afford when it comes to procuring some appliances. So they will know what your financial capability is and know what to do or direct you to the proper channel where you can source for help and all that. So we do that. We offer morals, financial support, and advice when it comes to that aspect, emotionally.
I get you.
Yeah.
As it relates to COVID, I understand that the rehab unit has been providing actual direct service to persons who are affected by the disease, those who are going through their recovery process. Could you touch on that and tell us how your service is helping persons who would have been infected with COVID-19 get back to a life of normalcy?
Okay. I can assure you the rehabilitation sector has played a major key role in trying to resuscitate patients with COVID-19. I can say vividly that or with full assurance that rehabilitation sector cut across all aspects of medicine. You know, it's something we really need to start encouraging. All right, gone are the days when we don't even see what rehab is. But this period or this moment, I mean, the pandemic has really shown people that without rehabilitation, a patient can't even stand. All right,
True.
a patient can't stand, can't even walk. It depends on what you do to that patient. And if a patient doesn't work, there are bound to be so many risk factors.
In terms of COVID,
Yeah, so in terms of COVID, the ICU, patients in the ICU, about 18 or over 18,000 patients with COVID-19 in the ICU bounce back to life after their rehabilitation care, you know, we are giving to them, right, to restore, you know.
Like in what way do you have to do actual physical
Yeah,
rehabilitation?
it involves some processes, like we have what we call drainage. All right, is an aspect in physiotherapy. They do drainage and vibration and try to your sitting position, your lying position, you know, all those things they have to really do to make you bounce back to life.
Well, I suspect, I'm just imagining that a person with COVID, I know that it affects your breathing.
Yeah.
So is this related, these exercises, are they related to breathing properly, or is it like something that...
Yeah. You know, when a patient lie down in a bed for a very long time,
Yeah.
that's what I was trying to explain. There are bound to be risk factors, like we have embolism, like pulmonary embolism, when blood clots,
Okay.
you know, try to obstruct the passage, the blood flow in the blood vessels. So these are as a result of prolonged lying in bed.
Okay.
All right, but a physiotherapist will come and get you up the bed, enroll you into a session that will make you ambulate. All right, that will make you at least bring back your blood circulation back, not just the medicine or the administration of drugs, but there are some exercises, you know, you have to be enrolled into to make you breathe well, to open you know, your lungs to fall back to life than collapsing, you know. So those are the trainings they give, which I mentioned earlier, like they vibrate you, they do drainage, then monitor you on your sitting and lying position, you know. And also there are so many patients, you know, in this ICU who can't even walk without, there are amputees who have caught COVID, all right, they contracted COVID, and they can't walk, they can't ambulate except to give them prosthesis to walk, all right, so, or you give them support for them to walk. So you see, is interrelated. So they can't do that except this is provided.
Wow.
So that's it.
And when you're preparing to, I don't know if you work directly with them, but when you're preparing a staff to go into, I can imagine, the COVID-19 hospital or the ICU, it wouldn't be easy. I know you're health workers and you're professionally trained, but how do you like prep them to go into that environment?
Okay, just like I said previously, is really challenging, but we are now more, we've outgrown that fear now. I think when it initially started, I always say Dr. Manga was the first to show an exemplary, you know, life at, like, she first entered. She volunteered to go first. You know, a leader, like they always say, a leader serves. All right, so she went first to the ICU to visit the COVID patient. She said, if they are to send my people, I will have to go first and experience what it is. So she went. So for you to go there, you have to wear your PPE. You know, you wear your PPE, wear your face shield, wear your gloves and everything. Make sure everything is airtight. All right. So you go and see your patient normal, and they are being trained in such a way that you know how to wear these things.
Yes.
You know how to pull them out, because you do not want to contaminate your body trying to pull them out. So there are ways you pull out your gloves, take off your PPE, and go straight to the washroom. All right. So those are the techniques. Those are the guidelines in trying to, and the government tries a lot to provide this PPE. All right. They provide a lot of the materials that are necessary for the physiotherapists to see patients in the ICU. So it's been really going well, and I can say I thank God that no one has come down with this COVID or contracted this COVID ever since they started. Seeing patients in the ICU. I think they've seen over 1,800 patients in the ICU, which have recovered. So not a record of a professional that has come down with this COVID. Based on the the way they follow things and the guidelines. Okay. So that's it.
All right. You mentioned Dr. Mangar, but for those who are listening and who don't know who she is the manager of...
No, she is the director.
The director, of the rehabilitation services and disability services in Guyana. And she has been doing a wonderful job. And she's not the person who likes to come to the front, but we're shouting out to her today because she's been very, very committed to what she's doing.
She's doing, actually.
You can hear from her staff how she's being praised because she's very, very good at what she does.
Yeah, she's doing a good job.
All right, so we'll take a short break now. When we come back, we'll talk a bit more about some of the other things that you would want to know about rehabilitation, especially physical rehabilitation in Guyana, rehabilitation services in Guyana.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Berbice 99.5 FM. Kaieteur Radio.
The COVID-19 vaccine gives us hope for a healthier tomorrow. Have you received your shot yet? The Regional Health Services in Region 2 invite you to get vaxxed and get a chance to receive a COVAX hamper. A what? A COVAX hamper. When vaccinated, you will receive a coupon, and drawings will be done weekly at the Suddy Health Center and broadcast live on the Regional Health Services Facebook page on Sundays. Get vaccinated and get a chance to be one of 4 lucky winners of a COVAX hamper. Pomeroon Supernam, fighting COVID-19 for a safer region and safer Guyana.
Welcome back to Your Health Matters on Kaieteur Radio. I'm your host, Rihanna Ramsey, and we're talking about rehab services in the face of a global pandemic. And we have with us Mr. Kingsley and Guzo. I probably butchered the last name there, but he's a Nigerian in Guyana, a Nigerian health worker in Guyana, and he's been here for over a year now, attached to the rehab facility, our rehab services under the Ministry of Health, and he deals with a specific area, and he's going to tell us more about that as we go on. But our focus today is how the rehab service has been operating in the face of COVID-19. And Mr. Kingsley, because I'll call you by your first name.
It's all right.
Could you tell us what types of patients, because we touched on COVID-19 patients needing to go through, some of them, especially when they reach to a point where they end up in the ICU, and they would probably need to go through this whole process of having to learn how to breathe properly and all of that. People don't know this, so people out there, protect yourselves. Do not play with COVID-19. If you're not wearing a mask, today we're not in mass today in the studio, but we are socially distanced. We are a couple 6 feet apart. We're not trying to get any spread any disease or anything. So we're asking you to, once you can, wear your mask, stay 6 feet apart and do what is necessary to stay away to keep COVID at bay, because you don't want to have to go through the whole process and have to be rehabilitated. Mr. Kingsley, you can tell us about some of the other patients that would require rehabilitation besides persons who would have been affected by COVID.
Okay. I will start with saying from the Tolmeri Rehabilitation Center, we have various units in Rehabilitation Center. We have the physiotherapy department, which has the subunits of the occupational therapy.
Yes.
And the therapy department, which has the physiotherapy and the occupational therapy and speech therapy. All right. So these department, they do a lot of work, like I said earlier, in the musculoskeletal build-up. Okay. And we also have the orthotic and prosthetic workshop. Then we in the workshop we have audiology unit as a subunit there for those who have hearing impairment.
Yes.
Then we also we offer vocational training for children who need these special needs. Okay, children and adolescents who need this training, so we give them vocational trainings. Also, we have daycare in the center for children with disability. Okay. Then we also have special education. That's the school. All right. Who train these kids. All right. The children, back in the days, when a patient is disabled, you treat the patient as an outcast, as if that person is not going to acquire anything in life. But that's not the case now. The system has been structured in such a way that even if you are disabled, that doesn't make you less of a human. All right, you can be given the same training somebody with a sound mind has too. So we have special education for these people. All right, yeah. Then also we have dormitory, the dormitory, or like a part-time residence for children and adolescents who need this special care.
Yeah.
So these are the units. These are the things we do. The services we render in the rehab. Yeah.
In terms of like patients who would have had a stroke, do you offer support for them? Persons who would have had a knee injury, what type of therapy is available?
Okay. People with hand, or let me just generalize it, upper limb and lower limb deformities. It varies. Okay. We have we call it the orthotic appliance that we give to them. But meanwhile, the physiotherapists will first of all see these patients, all right, carry out the assessment. We have standard operating techniques, okay, we use based on a patient coming into you from a doctor, or a patient coming in just on his or her own. That's non-referral and referral patients. For instance, if a patient is coming based on referral from a doctor, we already will get the prescription, all right, sheet, and read it and know exactly what the doctor wants. All right, then we'll proceed. If it's for physiotherapy, they'll proceed to physiotherapy for the treatment. If it's for orthotic and prosthetic section of the workshop, they will come directly to us and we proceed. Then for patients that are non-referral, they just come to the rehab center and then they are seeking for services. So they have to come. If they come to the workshop directly, or first of all, they have to meet the security. The security has to direct them to the admin. Then the admin will now take the prescription and know where they fall into. If they are to get the services of the physiotherapist, then they will refer them there. So if it's knee injury or hand injury, they will now refer to us, the orthotic workshop. Then we'll now provide splint to support whatever that is weak. All right. If it's if it's drop wrist, we need to provide what we call cock-up splint or volar slab to cock it up. okay, to put it in a functional position. Okay, if it's something that has to do with lower limb, we have KFO, we have braces we can, do for these patients to support them to walk properly. So it depends on the severity of the case, or maybe whatever that is recommended from the doctor, or whatever disability they have. So we treat them based on the disability they have, and we have numerous disabilities. I can't start calling them. They are very quite numerous. All right. So disability of the upper limb, the spinal, and the lower limb, they are too much. All right. So.
Was there ever a case where a person who would have suffered a stroke or went in an accident, who the doctor said, okay, I don't think you will ever be able to walk normally again, and that person went to rehab and they beat the doctor's expectation and they came back to walking normally or functioning normally? Are there ever cases like those?
Yeah, we have cases like that. Spinal injury cases are very difficult to manage.
Yes,
okay, they are very difficult to manage. Aside the physical therapy sessions and program that is being offered to that patient, they also need an assistive device to help them walk or stand or ambulate. All right. So for instance, a patient that is suffering from stroke, obviously the patient needs a support, like sometimes we give them HKFO, hip, knee, ankle, foot orthosis. Is a bilateral brace we give them to hold the entire limb to support them. Then also you can give them a spinal jacket to hold their trunk erect, because their trunk, the muscles are very weak because they can't stand on their own. So these are the appliances we give to them to brace them up to support the work of the physiotherapy.
Yes.
All right, because without that, after the physiotherapy must have worked on them, they still need to go home on a brace.
Yes.
On something to fall back to. All right. So there are so many cases like that. So where we'll treat patients,
and they come back to.
They come back. Yeah, they come back with good prognosis. Yeah, they come back with good prognosis, improving. It's something that they improve. Stroke patients improve gradually. They don't just improve holistically, like acutely. No, it's something chronic. It comes gradually. They improve. Yeah, but we have cases of stroke patients that fully recovered. Yeah. So that's it.
Yeah. What if a patient is not able to? I don't know. You said it's gradually. So how long does it take before, or is it a case-to-case basis? Because somebody might recover quicker, much faster than another. Someone might recover at a faster rate than the other person. But what if the person is not, an individual doesn't want to go through the therapy? Are there alternatives to that?
All right. Like a stroke patient who doesn't want to go through the
generally, I'm talking in general. If they, I know rehabilitation got different aspects, but if a patient does not want to go through the actual process of going to the exercise or using whatever is recommended, are there alternatives to this type of rehabilitation or no?
I don't think there is any other alternative. in rehabilitation, it's just one thing works for you.
Okay.
It's just one principle.
Okay.
All right. Your motor nerves, your sensory nerves, they have to be innervated. All right, for you to have the senses. It's just like when a limb is paralyzed. There is nothing you can do to get it back to life. Than you need to innervate those nerves, the motor neurons and the sensory neurons. You need to get them back to life.
Yes.
It's only when you do that that limb will be functional. Again, if you don't do that, it will take. It's not as if there are some measures you leave a patient just like that, you leave him lying fallow, they won't come to rehab. It prolongs their recovery time. If they are to recover in a year, okay, it prolongs it to 2 or 3 years.
Okay.
And with huge complication. Because you see, someone who doesn't work, someone who can't even lift up him or herself, there is nothing you can do. There are so many complications attached to someone that is sitting down, for a very long time. We talked about pulmonary embolism or thromboembolism. Okay. Then we talk about atrophy. The limbs will start losing their bulkiness. All right, they will start shrinking due to disuse. They will start becoming smaller, reducing the bulkiness of the flesh or the tissue. They become smaller. Okay, and as it becomes smaller, okay, as a result of disuse, the function, okay, or the strength is being reduced too. So is the best or the quicker you go visit a rehab, the better your recovery. So if you sit at home and say, I don't want to go for therapy, you're doing yourself more harm than good. So the earlier you go for rehab, the quicker you recover. Yeah. So there is no two ways about it. Like, I don't want to go for rehab, I should sit back home. You're doing yourself more harm than good.
In terms of support, how important is family support in going through this whole process of rehabilitation? Well,
family support play a very key role. They say charity begins at home, right?
Yeah.
So I think family gives a good acceptance and support, okay, to individuals with disability. All right. They provide this positive vibe.
Yes.
All right. They provide positive vibe and reinforcement for them to recover very fast.
Yes.
Okay. So if without family acceptance, without family open communication and inspiration, okay, there are so many things you may not achieve because it reduces your disability reduces self-worth and self-esteem.
Yeah.
All right. So once your family is not there to serve as a bulwark to you emotionally, you're going to derail mentally. So they serve as a very good support and play a very key role, to your fast recovery. Yeah.
Earlier we touched on how many, if you would have been affected in terms of the services you provide, but are you seeing more gynaes tapping into the rehab services, especially during the pandemic? Was there a decline in the clientele or the patients coming to you?
All right. That there is pandemic does not mean people still do not have.
Yeah, but I'm talking about them coming to you because, most persons were locked away and they were like, at least for the first part of the pandemic. Now we're getting back to a state of normalcy. Okay. But before we would have seen people not going out too much to see the doctor and stuff. Has there been a decline or are they coming back?
All right. To that, I would say people have started to embrace rehabilitation now because is really supporting a lot of disabled patients. All right. They've started to see the need, okay, the important. Essentially, I would say the level of amputation, okay, in Guyana is at its rise. It's getting to the peak. I think it's high time Guyanese started looking into what they eat. The rate of diabetes. If I should check the cause of amputation that is in my record, we have PVD, that's peripheral vascular deficiency, and we have diabetes. We have road traffic accident, but diabetes is on the increase.
Wow.
If we have 10 patients with amputation or amputees, if you ask them the cause of the amputation, they will tell you it's diabetes, sugar.
Dang.
You see, and we also have to hint on compliance. Some of them, when doctors prescribe drugs for them, they don't comply. They always believe they can fall back to life, like their life should go back to normal without taking those drugs. If you are diabetic, you are diabetic. There's nothing you can do about it. And so long as you eat 3 square meals per day, you should be able to take your drugs 3 times a day. Anything that goes in is sugar most times, and you need to reduce it.
God.
Okay, so when it comes to that aspect, I think we are even having more patients now.
With
Even in the amidst pandemic, we are still having more patients coming to us. Sometimes they will troop in as if they blew whistle for them. They will just come in just like this morning. I still have about 6 patients waiting in the room there.
And these are amputees, all amputees?
We have amputees and people who need braces, splints, and all that.
Splints would be the
orthosis. When I say splints, braces, I'm talking about the orthosis. We'll still go into that. The orthosis, anything used to support the body.
Okay.
Yeah, but prosthesis, anything that replaces the lost body part.
We'll go into that a little bit later.
Yeah. So, these patients, they really need to have drug adherence or compliance. Okay, and also watch what they eat.
Wow.
Okay, so that's it.
All right, we'll just go to a quick break, and when we come back, we'll hear more about what's the word? Prosthesis, and the other thing.
Okay, problem.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio.
Welcome back to your Health Matters in Kaieteur Radio. Mr. Kingsley here, the manager of the Orthotic and Prosthesis workshop. I hope I have the words correctly.
Yes.
He is going to explain to us the difference between the two and what they mean. We're talking about rehabilitation services, providing that service in the midst of the global pandemic, and he is a part of this unit, so he's going to explain to us what splints are and the whole bit.
Okay.
Go ahead.
All right. When we talk about orthosis, we talk about the appliance appliance or device that is used to support a weak body part. Okay. So when we talk about prosthesis, it's an artificial limb. It's a device used to replace a lost body part. For instance, amputees, people who have lost their limb to diabetes or road traffic accident or PVD, peripheral vascular deficiency, or malignancy like cancer and all that. So we provide artificial limb, okay? We provide artificial limb to serve or to replace the function of the lost body part. So that is prosthesis. Then when we're talking about orthosis, we're talking about a device used to support a weak body part. It could be a brace, it could be a splint. Even most of us who know, like in the hospital, if you have a fracture, all right, then at the accident and emergency, they will first of all, if you have a broken bone, they'll first of all hold it with some splints and all that. Sometimes they cast it. Those things are orthotics.
Okay.
So because they are used in the support of, at that point, is a weak limb because it's fractured, it's weak. You can't use it to do nothing. All right. So they use it to support the body or the body part. So it's orthosis. So those are the two different.
And when you're considering what a patient should, like say an amputee or a patient, what are the considerations that you take before you say who should use what? Okay,
that's the consideration in providing prosthesis for a patient.
Yes.
Okay, when a patient comes in, first of all, we have standard operative procedure. All right, like I said earlier. if a patient is coming from a doctor, like maybe from GPHC, they will tell us, I need this patient has a below the knee amputation. Okay, so we already know what to do. Then if the patient comes in, what we'll have to do now, we send the patient to the physiotherapist. All right, we'll send them to the therapy department. They will start what we call stump bandaging. Okay, because we have an ideal way a stump should be. We have bulbous type, we have cylindrical type, we have conical type of stump. So the ideal one we recommend is conical type of stump. And for you to make it conical, you have to start applying your bandage. Okay, we have the therapists, they have the techniques of how to apply this bandage on a patient and teach the patient on how to effectively apply this bandage to give us what we need at a specified time. All right, so if you don't do this bandaging, it will elongate, all right, the period at which you are supposed to come. Okay, so following surgery, you should be advised to start your stump bandaging. The earlier the better, so that to give you the conical shape we need. Then the physiotherapists also will have to ensure that there is no contracture, or there is impairment to range of motion of the joint. If it's below the knee, you still have your knee preserved, your knee joint. So the knee joint is supposed to be, at least you have to flex it, extend. Those are the things we assess to make sure you are fit for prosthesis. I can't give you a prosthesis when the range of motion is insufficient. You can't even extend, you can't even flex. So the aim of the provision for the prosthesis will be defeated if you don't have a good range of motion. All right, so these are the things the physiotherapists ensure that there is a good or there is efficient good range of motion of the joint, and also the muscle is strong enough, is strengthened enough to fit into the prosthesis, and is conical. So those are the things we assess, the major things we assess.
So you just don't give them a prosthetic leg or
no.
Or
we carry out an assessment. If you come, we book an appointment with you and check the stump viability. Okay, check the strength and the joints, and make sure that they have good range of motion, and also the shape of it. And also we take into cognizance where there is ulcer on the leg. Maybe all these most diabetic patients, they have ulcer around the residual limb, which is the stump. So we have to make sure that those wound or ulcers are closed up.
Ouch.
I can't give you a prosthesis when you have a wound, okay? Because it is not encouraging when you put your stump in the socket of the prosthesis, okay? Due to the enclosure, it might erode the ulcer back more or widen it. So it's advised you should get it treated.
Yes.
At least it shall have been closed before you come for for prosthesis. In that aspect, the stump bandaging should also be going on while you taking dressings and all that.
Okay, I guess you have your work cut out for you there, because that.
Yeah, a lot of words,
Wow. In terms of the availability, we know that the services are available, but what cost is attached? Is there a cost attached to having your leg be fitted with a prosthetic, or orthosis? And generally, how do you access it? Do we have to pay for rehabilitation services here?
Yeah, Tolmiri Rehabilitation Center is a non-profit organization. All right, we provide our services to the benefit of the Guyanese. The organization or the rehabilitation center is not there to reap any fruit.
Yeah.
All right. So we render the services almost for free.
Oh wow.
I use the word almost for free because the materials we buy, we procure from overseas. All right, they have cost attached to them. All right, so and most times we need to recover this cost to be able to make back supply. All right, to make back order to get these supplies from overseas. So if a material cost, let's say if a material costs 100 US, okay, that same 100 US dollars that the material cost, after the provision of processes, that same thing I'm going to charge you. I'm just giving you instance. All right, I'm just giving you instance. So that same thing they're going to charge you. So we don't have any workmanship or service delivery costs attached to. We give you the processes based on the cost. We got the materials. I don't know if you get that.
I get that.
So that's
I get
how
that.
it is.
I get that. It's not completely free in that the material to build the mechanism that you need to function is costly on you. So it's on. So the service asks you to pay a fee or a price based on what you have to build.
Exactly. Well, based on the cost of the materials we import from the abroad. So that's it. The services, that's why I said is
almost free.
It's almost free.
Last week we had the Ministry of Health had the week of activities for rehabilitation and disability and rehabilitation week. Could you touch on some of the awareness activities that went on?
All right. Rehab week is what we do celebrate in Ghana all the time. Okay, it's a kind of an awareness, and it's a sort of way to encourage professionals.
Yes.
All right. You know, in this our line of work, when you encourage us, we do more. Right, because it has to do with presentation of awards to people who are resilient, industrious, and people who have given in so much to, to save lives. Amidst the pandemic, they took it upon themselves that they don't even care about what is going to happen or the after effect. All right, their mind is just stereotyped on, let me get this patient back on his or her feet.
Yeah. So
these are the people we recognize in this service. So, and also it has a way of educating people, and like we had symposiums, so you educate people based on things in the rehab and things that you need to know as a rehab professional too. So it's a kind of awareness thing. It's quite informative, so that's Rehab Week, and you do a lot of games, and it's just a way of celebrating and telling ourselves that we need to encourage ourselves. Okay. All right, so that's basically the Rehab Week.
And given that you're working at the Ptolemy Reed Center, give us a little bit of background about the center. I'm sure you would have some knowledge. And
all right, Rehab Ptolemy Reed Rehabilitation Center, like I said, is a non-profit organization. All right, which provide rehabilitation services to children and adults who have physical and developmental milestones or disabilities. All right, and this center has been existing since 90s. It was established in 1967 by Ministry of Health. All right, then it used to be called Polio Center. Yeah, it used to be called Polio Center because due to the outbreak of polio then, a lot of children were being sent to the center to be braced up, to be given like the caliper, the KFO I mentioned and all that. So because of that, my workshop was known as a brace shop then. So as time goes on, we now gain national recognition, as National Rehabilitation Complex. All right. So that is how it is. And then government has been overseeing our subventions and employment of staff and all that. Okay. So then around 1960 and 1964, which had the outbreak of the polio. That's when we started looking into building a workshop.
Yeah.
Okay, we built the workshop. The workshop was established in 1994. Okay, because of how essential it is in the rehab system. So we have to build. The government has to build the workshop in 1994
Yes.
and equip it with machines and technicians that are trained abroad. So ever since then, we've been doing a very great work and serving the people of Guyana. So that's a little about the history of Tolmiri, and it has other units that we are still mapped out in this same period. All right, like the dormitory, the daycare, the therapy section, the audiology, and the special education. Which is the school. All right, and the school is overseen by Ministry of Health too. Ministry of Education too. All right, so they make sure that everything is in synergy. We work as a team to deliver the healthcare service.
So we have been talking to you for like almost an hour now. If you didn't realize it, I just made you realize it's an hour, and the time has gone by quite quickly, and so we're about to wrap up. And so I'll ask Mr. Kingsley to tell us how, as a frontline worker who's working in the rehab service, how he encourages his patients to get vaccinated and stay safe so that they can protect themselves from COVID. And I'll just let him rehash how you can access rehab services in Guyana just before we go. Go ahead, Mr. Kingsley.
Okay. When it comes to we try as much as we can to see that we follow the COVID-19 guidelines, all right? And whatever the government says as a guideline, for the COVID-19, they pass a memo, they pass a circular, and which we follow, all right? Then the vaccine, we encourage our staff to go for vaccination, all right? And which a quite number obliged, all right? So we try as much as possible to see that we follow these guidelines, and because I would be happy if at some point of the year, all right, people won't be going to work with their mask on. I can't wait to see such a day.
Yes.
All right. So that's just it. So we encourage people to take their vaccines and follow the guidelines so that we curb the rate of spread of this COVID-19.
Yeah.
All right. So that's it. And when it comes to people assessing the rehab, the center is located at 131, 132 Kaieteur Street. So I don't know, people initially know it as Polio Center, but now it is. There's a signboard there, is written National Rehabilitation Complex, Tolmiri Rehabilitation Center. So either one, and I think it's a popular place. It's just one of its kind in Guyana. When you mention it, people will direct you to the place. So it's very easily accessible, So, and for you to, any person in Guyana with disability can always come there, and we offer you our advice and the necessary support and care and treatment we think that is deem fit that that you benefit from. So that's it.
Okay. All right, folks. Thank you so much. We're at least 1 minute past the hour to 1400 hours, and we just want to thank Mr. Kingsley Izeguzo
Yeah.
for coming and sharing with us on rehabilitation services during the pandemic. And we just want to thank you for joining us this week. Be sure to tune in and ask questions. Use Facebook, and so that you can get a live feedback. So until next time, on behalf of the Kaieteur Radio family here, I just want to wish you a pleasant rest of the week, and do stay safe and be good to yourselves. Goodbye.
All right. Thank you.
The COVID-19 vaccine gives us hope for a healthier tomorrow. Have you received your shot yet? The Regional Health Services in Region 2 invite you to get vaxxed and get a chance to receive a COVAX hamper.